Welcome. Lunch with the Doc has begun. We're at Jan's Health Bar right here on the corner of Boat Canyon and Pacific Coast Highway. Glad to have you here with my beautiful, lovely daughter, Aria. And Mo is behind the camera today.
Hello.
So we're going to go in and order. They're going to give us a beautiful lunch today. We want to acquaint you with this place because it's really good organic food. So come on in.
So beautiful in here. Very
So
clean
beautiful.
and crisp. Very clean
And
and
the
crisp.
food is phenomenal.
Hi guys.
Hello, how are you?
Maria always started waiting. This is Barry. Hi, Barry. I'm Dr. Arthur. My daughter Maria that you talked to. My other daughter Aria.
Nice to meet you.
Thank you so much for treating us. So we want to tell the whole city of Laguna and all of our followers all over Orange County and some overseas, when you come to Laguna, come to Jan's because the food is fantastic, all natural, organic. Check this menu out. This is awesome. Got acai bowls, incredible salads. You can add in any kind of protein that you want. Smoothies, sandwiches, fresh juices. This looks really, really good. And you got your breakfast stuff as well. Now we already ordered, I ordered a, what did I order? I think tsunami. Yeah, tsunami, that's what I want. No mango. And then
I'll have the kale salad with tuna, please. With no cranberries.
and I'll have the tsunami, the chicken salad. And then, what do you want?
I'll also do the kale salad with
Look
tuna.
at that food walking by. Look at that food.
Yes, that'd be great. Thank you.
And then how about a juice where we could do, maybe we could just get one juice and split it between the three of us.
Okay, yeah, just choose one.
What do you guys want? You want?
Are we going to go green or okay?
Let's try to go green.
Go green?
Yeah, just a large one split.
Sorry, can I take her?
Yeah, of course.
Sorry.
Sorry guys.
You're good.
Thank you so much. Tell your owner and ask him to thank him.
Okay, I will let
Take
you know.
care of it.
I'll take it out to
Yeah, and then what you can do is go over and tell your owners to go to health and balance integrative medicine, and then you can watch today's TV show. Yeah, we'll do it before we leave.
Okay.
Thank you.
All right, here we go.
Thank you.
They were even nice enough to turn off the music for us so you could actually hear us talk about music.
Ooh. Amazing. Good spot here.
Very nice.
Okay.
Little avocado.
Oh, yeah, the avocados.
Avocado wall.
They're,
Yeah.
they're all different avocados you can find. So what are we talking about today, Dr. Gary Arthur,
decided-
DC?
Well, one of the things we found is that knees are so commonly injured, and it's one of the most common complaints we see in our practice. You know, over 30 years of being a certified applied kinesiologist, a doctor of chiropractic, and I'm just finishing up my naturopathic degree as well as a holistic health coach, a Czech practitioner, a lot of stuff I've studied over the years, an NET practitioner. What it comes down to is that a lot of people have similar complaints, and you see them over and over and over again. So the low back pain is probably the first one. A lot of times with sciatica. Then we have neck pain, knee pain, shoulder pain. Those are our biggest, most common structural things. And then we go into hand and elbows and ankles and feet and plantar fasciitis and a bunch of stuff like that. But with knees, if I was to specialize in just one joint, it may be the knee, because the knee is a complex structure and so many people have it. I mean, how many of you that are watching have been athletes, you know, growing up? Pretty much everybody. You know, everybody walks, runs, snow skis. I mean, not everybody snow skis, but everybody's had their things they've done, whether it's water skiing, what have you, riding a bike. And the knee is such an interesting structure because it really only bends one way. And you know, it's this process of going like this that's the important thing. If it twists and goes like that, you're going to wear down this meniscus. So this is your femur bone that goes up and attaches into your hip. This is your tibia down here, that's your shin bone. And this is this little bone on the side called a fibula. Now when you sprain your ankle, a lot of times, when it goes under like this, it also affects the head of this fibula, which has to be addressed as well. Even spraining an ankle will actually cause everything to go like this under, and then that can actually set the knee in the wrong place as well. This is a patella, or your kneecap. This protects your knee from injury, and it also helps to keep the knee in a smooth groove like this, moving forwards and backwards. Now, let's do this. See, they're making our juice right now. Can you hear that? All right. Now, Mo, I want you to focus in on this part right here. This is the back of the knee. So here you have your calf muscle called the gastrocnemius. You have a little muscle in here called the popliteus, which helps to keep your knee from hyperextending. Then you have your hamstring muscles, the semitendinosus, the semimembranosus, and the biceps femoris that comes down. Then you have this muscle on the side right here. This is called the the tensor fascia lata is up here, but the iliotibial band comes down and gives support to your the side of your knee. I always think of the knee as 4 sections of the knee. This is the posterior. The inside here would be the medial. The outside here would be the lateral compartment. And then this would be the anterior compartment, or the front compartment. So all these muscles make up the compartments that help to keep your knee stable. Then you also have up here, you have the quadriceps, the vastus medialis, the vastus intermedius, the rectus femoris, and the vastus lateralis. One of the most important muscles that supports your knee on the medial side is the sartorius. Sartorius is from the Italian or Latin word sartori, and that sartori is a tailor in Italian and Latin. That is the muscle that a tailor would use when he was actually using a sewing machine. He would have to make his leg go back and forth like this to push the sewing machine. Interestingly enough, there was a study, they found what college has the highest amount. Oh, thank you so much. Wow, you guys are fast. Are you kidding me?
That one is the beautiful Tuscany salad.
Wow.
That one is your healthy juice.
Amazing.
All right.
Thank you so much.
And your name?
Great
Abdul.
service.
Abdul?
Yes, ABDO.
You've been there.
Thanks for coming, guys.
All right.
Thanks for having us.
You are
Jocelyn.
Jocelyn. She's
Amazing.
so
Hi,
friendly.
that's for me. Here
Thank
you go.
you so much.
You're welcome.
Beautiful.
Awesome. Thank
There
you
you go.
guys.
Of course, enjoy it.
Look at this beautiful food. There's the kale salad. Another kale salad. What did you get?
I got the tsunami salad
Amazing.
without the mangoes.
We got some green juice.
Not that I don't like mangoes, I do, but right now I'm on a diet where mangoes are not allowed. So, we were talking about what university in America has the highest incidence of, of knee injuries. So now when they did this study back in the early 80s, what they found was West Point had the highest amount of knee injuries of any school in America. And they're thinking like, why is West Point? What's different about West Point? Why would they have more injuries? Well, number one, this comes down to the stress load. These people are going through basic training, which is extremely stressful, and the academic standards are very, very high, so they have long hours. But then what do college kids do on the weekend when they're not in school and studying? Well, not all college kids, I will say. I'm sure my kids were very different.
Aria can vouch for that.
Yeah. Yes. But what do a lot of kids, maybe you could tell me, I know what my friends used to do, me and my friends used to do on the weekends. What do you think?
I would say they probably party. Yeah.
Yeah. What does that entail?
I mean, staying up late, generally, drinking alcohol, and
Alcoholic beverage.
other things.
Doing
Yeah.
other things.
Right.
Eating sugar. These are stressors. These are all stressors. Now, in a system called applied kinesiology, this muscle that I showed you right here, the sartorius, is on the same circuit as the adrenal glands. And what they end up happening is sometimes you find if there's a stressor in a certain circuit, it can kind of blow the circuit and make the muscle not be as able to sustain a contraction. And this is something that is really interesting, because if you lose your medial stability of the knee, if this starts to not be held down in place, you're going to get an abnormal torquing or twisting of the knee, which can lead to knee injuries and meniscus injuries. So this in here, this is the meniscus. This is called the medial meniscus, the lateral meniscus. This is the anterior cruciate ligament, and this is the posterior cruciate ligament. This one here is the medial collateral ligament and the lateral collateral ligament. All of these ligaments are there to stabilize your knee so it doesn't move too far and get injured or tear the meniscus. So, in regards to that, you want to make sure that the muscles in the front, on the side, in the back, and on the inside are all strong and are balanced and synergistic in their pull to stabilize it. You want to make sure your ligaments are strong, and these here are the tendons that go to the muscles. So the big picture is we got to have the knee tracking correctly when you put it under load. When you're going upstairs, you're doing spin class, you're doing squats, or whatever kind of exercise you're doing, it needs to track correctly. But commonly, an injury like in football where they come in this way, you can actually, if they take a force this way, it can be enough. You see this stretch, bam, it can break and tear that ligament. Now ligaments can be strained or torn in 3 different ways: a grade 1, a grade 2, or a grade 3 strain or sprain of a ligament or a tendon. So the reality is we have positional stresses from muscles being out of balance. You have injuries that injured our knee one way or another, like a ski injury where your ski went wham like this, and as a result we tear a meniscus here or tear ligaments. And then the other thing is that we look at, are there old injuries in other places that, like the glute or like the low back, that could cause scar tissue. That's why I brought my little baseball.
I was going to ask a question though.
Yeah, go ahead.
About the West Point.
Yeah.
Boy, so you said that the reason that they had a lot of knee problems is because their adrenals were associated with a specific muscle in their knee?
Yes, based on applied kinesiology findings, there's circuits in Chinese medicine and acupuncture, and some of these circuits are involved with not only organ systems, but with certain muscles as well. So the adrenal glands and the sartorius muscle are on the same circuit. So if they're stressing themselves, stressing their body, and their adrenals become overworked, they're not getting enough sleep deprivation, all those kind of things, then they found that there was a tendency for a laxity of the muscle, and it wasn't as strong and able to support the knee. So now let's talk about how the body heals when we get injured. There's 3 stages. One is the initial inflammatory stage. When there's an injury, there's 3 days of inflammation, up to 3 days, 72 hours. And then the body starts the second phase, which is called the repair stage, or the proliferative stage. That means that your body, if this tissue was overstretched like that and torn either fully or partially, after the inflammation sets up, now your body's going to start laying down scar tissue, collagen bands of fibrous tissue, like scar tissue adhesions is the same term for it, that basically are going to try to repair that area. But the most important thing is this, is that you have to keep it moving over the next 12 weeks to make it so that only the tissues that are in alignment with the original tissues are the ones that stay. because otherwise they're laid down randomly. And if you don't keep that area moving while it's healing for those next 12 weeks, you're going to have this ball of adhesion. So I took a baseball apart. I use this as an analogy of the skin over the top. This is like normal fascia over a muscle. Like when you get a chicken at home, that shiny layer of stuff is what the fascia is, and that's what separates the muscles. But if you get a trauma and you immobilize the area, it means you're going to get this big wad of fibrous scar tissue of adhesion. And that's going to make it so the joint doesn't move very well, and now the tissues, instead of being flexible to stretch when they need to and contract when they need to, they're going to have this big ball of adhesions. Like, ball of confusions. Well, this is a ball of adhesions. So, you don't want this. This is not good stuff. And this is what our bodies are filled with, because we've all had tons of injuries. We've all had injury and injury and injury. Every time those injuries, one old study by OSHA that came out, I think in I'm not sure exactly what year, but they said that the average little boy, by the time he reached his 6th birthday, had an average of about 200 traumas. So about one every 10 days, there was another trauma. So layer upon layer upon layer, as we get older, we fell off the bike. We fell off the monkey bars. We fell on our water ski trip, and then the toboggan, and then the down the stairs, off the diaper changing table. Our brother came up from behind us, and the other brother pushed us from behind and watched us fall down behind and thought it was so funny. All that stuff, layer upon layer upon layer of trauma, and then this is what we get if we didn't know about how to rehab it. Now, when I was growing up, you know what they used to say? If you're not bleeding and it's not broken, you'll be fine, kid, get over it. Suck it up, get over it. And nobody really did the work to keep this from healing. Also, when I was a kid, when people would sprain their ankle real bad, they'd stick them in a cast. What would that do? This is what developed, and then this scar tissue is prone to calcify and turn into arthritic bone spurs and osteophytes. So if the joint isn't moving, it's going to start degenerating. It's going to start fusing. So now you go through a premature degeneration. Let me show you a picture of someone's x-ray that I took yesterday. Now this patient is thinking about getting stem cells. He's already been told there's no other hope for him but to have a knee replacement. So let me get this out for you.
So what is the best kind of movement then to do?
Well, the best thing is to do good flexibility exercises, like doing wall sits. Wall sits strengthen your quads. Doing bridges strengthen your glutes and your hamstrings. And doing side-to-side motions. You know, you can put those rubber bands now around your legs and go across the floor. Boom, 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 boom. The leg machines at the gym are really good as well. But the main thing, that's all good and well if you have proper tracking. Now we have a quick and easy way to find out how a knee is tracking, which way it's tracking. Is it stuck this way? Is it stuck this way? Is it stuck this way? Stuck that way? But usually what happens is with these adhesions, the most common area for these to form are in the glute. So if the glute comes over and attaches to your iliotibial band, they call it iliotibial band syndrome. When the iliotibial band starts to get too tight, what it does is it twists the knee externally like this, and the patella ends up being pulled laterally with it. And now you're walking through life and you're going like this every time you're exercising or moving. What do you think that's going to do to this meniscus over here? It's going to wear it out. Let me show you an example. Okay, Mo, you can, I'm going to have you, okay, look at this. Now that's a knee, but notice the dark space in between the two bones, which is what you're seeing right here. You're seeing this like that, right? That's what you're seeing. But look at the outside, there's a big place for cartilage, but look at the inside, there's hardly any cartilage left. So it's a real thin little tiny space. Now he's been told it's bone on bone, but in reality, you can see a dark space. If we couldn't see any dark space, that would have meant it's so degenerative that something like stem cells is probably not going to have much of a chance to really work. But in him, if we were able to start working on the way his knee is tracking, because I checked him out yesterday, his knee is tracking twisted to the outside. It's worn and torn this meniscus away. So if we were to start giving him stretches and exercises and do some tissue work to start loosening that glute muscle and get his knee to start tracking correctly, then we could brace him, because you also see what's happening here. His leg is too far out this way. If I put my finger on the middle of this bone and the middle of that bone, you see they're not a straight line. This needs to come this way. So we need to put a brace on him that's going to bring his knee over this way, and then start working on the tissue in his glute and giving him strengthening exercises to get it so it tracks better. Then you put the stem cells, or you put the stem cells in while you're doing the work, because the stem cells take 6 to 12 months to actually get the best result. But then they can start to repopulate and grow new cartilage in here. The stem cells will turn into what's called a fibroblast, and then from the fibroblast it turns into actual collagen, which makes cartilage. So that's basically how we help people who's already have significantly degenerative knees. A lot of times they're not significantly degenerated. If you catch it early, then you can actually start to reposition it and get it to calm down. We've helped people with torn meniscuses before, and some of them haven't needed surgery. Sometimes it's bad enough that sometimes they have to go in and, as they say, clean it up. But after they clean it up, what they've done is they've taken tissue out, and then that continues to have less spacing in the middle, like the ice cream in an ice cream sandwich, if you will. It starts to get thinner, and then we start to get the degenerative arthritis. So that leads me to ask you a question.
Yes.
What else do you think people would want to know about knees?
So for a young person who's in sports, how can they prevent against something like this happening? Is there any, well, I guess you did say those exercises. Are those things that can help prevent?
Yeah, it can help to strengthen the muscles in the compartments from side to side,
Okay.
front to back. Toe raisers, doing toe raisers, heels and toes up, and then also doing the other exercises that I talked about already.
Yeah.
Those are all really good. You can get on the hamstring machine, but if you feel anything, that's a warning sign. That's a warning sign something's not tracking right. Usually if your knees are pain-free, it's usually a pretty good sign that things are okay. It's just, if you get any little bit of pain, get it checked out quick so it doesn't continue worsening as time goes on. You end up tearing a meniscus or having to, heaven forbid, get a surgery. I do have a group of orthopedic surgeons that I've been referring to for the last almost 30 years. Actually, Mo, when you got your little special finger crushed, we went to my favorite orthopedic surgeon, Warren Kramer, and my famous spinal guy, Stan Kramer. Yeah, there's your special finger, and that's when Warren Kramer first took care of my daughter. The end of her finger got pinched off. She had no fingernail. Fortunately, it grew back. He did a great job. Special finger. Want me to kiss the hood? Kiss the special finger. So anyhow, take care of your knees. They're with you every step you take. Every step you take depends on good knee function. And if you have any more questions, or listen, if you want to come by for a complimentary consultation and have me test to see if you're twisted one way or another or anything like that, I'll do that complimentary. Just call the office, say I'd like to have a complimentary consultation with Dr. Arthur, with Dr. Jordan Martin. And that's really all you have to do. I'll just do a little complimentary checkup for you, and then if it looks like it'd be worthwhile, or if I think I can help you, I can do a much more comprehensive orthopedic test, do all of the the functional tests that we need to really determine what the diagnosis is, including take x-rays, order an MRI if we need to, whatever we need to do. Because once you get to the diagnosis, then you can put together a plan of care that's a logical plan of care that should show improvement, systematic improvement, little by little. Now, what else? Do you use your knees much when you dance?
Oh yeah, absolutely.
Boy, my girls dance. All those dance lessons have paid off. They really know how to move their body and have some fun. So,
Have you had knee pain? And if so, what did you do?
Well, actually, just recently I did have a little bit of knee pain. I think I hyperextended it a little bit when I was doing a plank on a ball in Pilates class. So I actually got treated by Dr. Lisa, and she found that my calf was too tight, and so that muscle was pulling my knee backwards. So I actually just recently got yesterday I got Graston on my calf.
what's Graston?
Graston is a technique that we use at our office to help break up scar tissue. We use little metal tools, and they break up the scar tissue, like Dr. Gary showed in the ball, these kind of like the scar tissue that forms, that's
Where that bump is.
yeah. And so underneath it, they will go over the skin and break it up, and then so it can become back to normal again.
They don't break the skin up.
Yeah, no, break up the scar tissue.
In the muscle.
Yeah, in the muscle.
So you put oil over the skin, and then you take a stainless steel instrument, you go back and forth, and start to loosen that scar tissue up. Sometimes it'll even look a little bruised. So if you see people around town with what looks like big hickeys on their neck or their shoulders or their arms, they'll probably come here and they get Graston, because we're all Graston certified. And we use a technique that really helps loosen things up. So that's it. Yeah, Dr. Lisa will do a complimentary consultation too. It's like 15 minutes of our time. We're happy to donate that, see if we can help you. That's part of our community health awareness program. By the way, next Wednesday night, we are inviting anyone interested in learning the most recent stuff on stem cells and how they can be used, and if stem cells might benefit you or someone you know and care about that's going through arthritic pain and would like to avoid having joint replacement surgery. We're doing a workshop on August 9th. How would they go about contacting us to get that information?
They can call us at 949-497-2553. You can also look on our website, all of our contact information.
What's our website?
healthinbalance.com. So that's a great way. It's going to be next Wednesday at El Torito in Laguna Hills. So anyone can join us for that. So that's exciting. So just to sum it up, all right, people with knee pain, one, to do stretches as well as strengthening exercises for the knee area.
Stretch your hamstrings, stretch your quads, stretch your lateral compartment, stretch your glutes, stretch your piriformis muscle. Yeah.
Two, determine if it's tracking correctly.
Yep.
If there's pain, get it looked at.
Get checked out.
To see if it is tracking correctly. Three, if you have really bad long-term knee pain, looking into stem cell therapy as a solution. And continuing to keep your stress down, number four, because stress is connected to the knee.
Right.
Anything else?
I don't think so, but if you do have questions, you can email us. Maria will get back to you with the answer. And that's what we do. We're here to help people get what they want, what they're looking for, get back to living the quality of life that makes them happy. So if you're, troubled with neck or back pain or shoulder or arm or knee pain or digestive upset, or you get sick too often, you're not sleeping well, have autoimmunity or stuff like that, hey, guess what? There's solutions. There are usually solutions to most problems. Some have gotten so far that you're going to have to medicate to somehow deal with it, but that should be a last resort, not a first resort. So we're always trying to find the what's causing the problem, how to fix the problem, and then if that problem is fixed, how's that going to affect your life? How's your life going to be different? How much more fun are you going to be around? And wouldn't your family members like to see you back to your non-hurting days, where you're not stressed, you're not dealing with pain? Probably. So, one more thing. You're amazing. We care for you. We want to help you get what you want, the level of health and vitality you want to achieve. We're here for you.
Amazing.
See you next week on Wednesday.
Yay! And thank you, Jan. Woo! We love Jan. Okay. Bye.